Hello, and welcome to Keeping It 100 Coalition Conversations, the official podcast for the National Coalition of 100 Black Women, Metropolitan Baton Rouge chapter. I'm your host, Shanice Lewis. Today, we're shining a spotlight on the Health Committee and the amazing advocacy work they're doing. I guess we'll be sharing more about their incredible initiatives and upcoming events. Plus, we'll learn how each and every one of us can lend our support and make a difference. Our first guest is Angela Norwood. Angela has been in nursing for 26 years. She is a graduate of Southern University A&M College, where she received her BSN in nursing. She also received her diploma in practical nursing from Louisiana Technical College. She has been wound care certified for the last 15 years. She is now a utilization review case manager with Houston Methodist The Woodlands in Houston, Texas. She has a background in med surg, telemetry, urgent care, adult and geri psych, wound care, and juvenile corrections. She previously served as a director of nursing and assistant director of nursing in different long-term care facilities in the Baton Rouge area. Angela is a charter member of Sigma Theta Tau Honor Society, Tau Pau chapter of Southern University, a charter member of Southern University School of Nursing Alumni Association, and a member of the Louisiana State Nurses Association. She has been a member of the National Coalition of 100 Black Women Metro Baton Rouge chapter since 2019, and she has served on the member care, membership, and health committee since she joined this great organization. Let's welcome Angela Norwood to the show. Hi,
Hello.
Angela.
Hello. How are you?
Good. Well, welcome to the show. The health committee has been doing such a good job. You are doing an amazing job as chair.
Oh, thank you so much. I appreciate that. We're
So,
very excited.
how long have you served as the chair of the health committee?
Well, I've inherited this position from our previous chair, Dr. Angela Harris Tolson, in October, but I was the Pink Fascinator T lead. So if you came to the Pink Fascinator T, I was the lead on that prior to being the chair.
So,
Just
why is it so important to bring awareness to health specifically to the Black community?
Well, I have a few reasons why. First of all, African Americans have a significant disparity in healthcare outcomes. For example, we have than other racial ethnic groups. For example, we have higher rates in hypertension, diabetes, and heart disease. And also, we face barriers in accessing healthcare due to lack of insurance, economic factors, and shortage in healthcare providers in hospitals and clinics in our area. For example, it would take you at least 20 to 30 minutes to get to a Trauma One center if you live in the North Baton Rouge, Zachary, or Baker area, because that location is only on Essen Lane. So we have a lot of issues and disparities due to infrastructure of highways and lack of clinics and hospitals in our area. And last but not least, it's very important to bring awareness to healthcare among Black people is because we have some mistrust in the medical system, and we need to address those things. For example, the Tuskegee Project. We're all familiar with that. So that causes mistrust in our community. Um, how we address pain, you know, a sad fact is, just as recent as 2016, they were still teaching medical doctors and residents that, you know, Black people nerve endings are less sensitive than white, or
Oh,
Black
really?
skin is thicker than white. And so, we can tolerate more pain. So we've been getting treated, people have been getting treated incorrectly or having complaints. Our complaints were just dismissed in the community, or we were just pushed underneath the rug. I know you've probably been to the doctor sometime, and your issue just been kind of like, oh, I still feel bad. Why you're not doing something for me? So we have to bring this awareness to the front, fold. And that's what the National Coalition of 100 Black Women are here to do. We're going to show you why you should seek medical attention, how to get preventative treatment, the various programs that we have to improve health care equity, and raise awareness so we can increase our resources where there's a need, and also change some healthcare policies in local and national level with the laws. And we're just here to advocate for the community, for the African American community. We're here to advocate for you.
Now, what specifically are the National Coalition of 100 Black Women's initiatives for health?
We're about the well-being of the whole community and the whole person. So some of our initiatives focus on cancer and health disparities, family and childhood obesity, metabolic syndrome, and access to affordable health care, quality of life, and the prevention and decrease of death mortality in the Black community by improving healthcare outcomes.
And so what are specific to the Baton Rouge chapter, the programs we have coming up?
Oh, we have a lot of stuff coming up. We have a lot of stuff coming up. So let's talk about one that's coming up in May 21st. It's going to be a virtual forum, and it's one of our two of our coalition sisters, Sister Janisha Tillman and Sister Moore, will take lead on our next program, and it's called Keeping It 100 Mental Health Series. It's called Gentle with Our Mental, strengthening the voice.
I like the name.
You like that?
Like that?
Strengthening the voice of women and mental health. And it's going to be a virtual 2-day part series on Tuesday, May 21st. With one session will be like a lunch and learn session presented by a licensed social worker. And the second session will be in the evening at 7 o'clock. And it's going to be presented by our very own sister, Daphne Webster, who is a psychiatric nurse practitioner. And we will be offering CEUs to social workers and nurses for this program, but it's also available for the public. And in this forum, we will address topics such as medication management and the stigma it has in the Black female community managing physical, dietary, and social health, and making a positive impact on that. And also, we want to raise awareness in destigmatize mental health conditions and encourage women, Black women, to seek help when needed, and also give you those resources.
That's amazing. Mental health is a big problem. The way people do mass shootings and
yes. Oh, definitely. Mental health, and we're just trying to break that stigma, and it's okay. We want to let you know that it's okay to be on medication, and that it's okay to go to the doctor, and it's okay if you can't find someone. You might have to find someone that look like you, Sister Shanice, to make you feel comfortable. I don't want to talk to somebody, and tell all my problems too. They don't understand what I'm going through, such as, I might be dealing with. Look, as Black women, we deal with stuff like microaggressive behavior at work, and you understand it, or I want to talk to someone that look like me that can understand what I'm going through and what's causing me anxiety at work and what's messing up my mental health at work. So those things that we want to put to the table.
And so what other programs are coming up besides mental health?
Okay. We also have coming up in the future in October, we're having our breast cancer awareness.
Now that's a big one.
That's a big one.
So tell us more about that.
That will be in October, preferably the first weekend of October. So be on the lookout for that. Last year, we had our first event, I want to say in October 2022. Am I correct, Sister Shanice? I want to say in 22. This will be the third one. So the first one we had approximately about 40 to 50 participants, and
Mhm.
we had Dr. Menard from
Mhm.
Ochsner, a surgical oncologist, and he came and spoke to us. And then last year we had 200 participants, and we had Dr. Bowie come in from Women's Hospital. She's also a surgical oncologist. And this year, look, we plan to go over 200. We plan to go bigger, better, or go home. So this year is going to be, it's going to be
Bigger and
wonderful.
better. And
It's going to be wonderful.
I heard that we had a success story that came out of last year's event from somebody that
Yes,
attended the event.
yes. Um, one of our participants, had ended up having breast cancer. Went to see Dr. Bowie, went through treatment. She is now cancer free, in remission. So hey, look, our programs work. We have the best speakers, and we have the best resources. Come to our programs. You see what's happening. You see what's happening. We have it right here.
Yeah, and African American women are 40% more likely to die from breast cancer. So that's why this is so important to educate the community about getting mammograms.
Oh yes, yes. Usually, um, it's not always just the common age that you're supposed to get the mammogram. They say 40 years you're supposed to get a yearly mammogram, but we're starting to see that females are getting mammograms younger and younger. So we encourage people to do self breast checks. um, if you feel something strange or something, on your breast, or a discharge or anything like that, a lump or discoloration, go to the doctor immediately, no matter how old you are. If you're 20, 30, go to the doctor. If you have a high um, family history of breast cancer in your family, you definitely need to start going at a younger age every year to get a mammogram, because usually by the time Black women usually go to the doctor, it's usually too late. Um, you say 40%, but it's a higher number of white women that do get breast cancer. But we're higher in Black women are higher in numbers of dying from breast cancer. So we're trying to prevent that. We're trying to prevent that.
Absolutely. And then one of the things that came out from having such a successful event for breast cancer awareness is we participated in a Women's Hospital Breast Cancer Community Fundraiser Challenge. Now tell
Yes,
us what
we
that is.
did. We did. We partnered with Women's Hospital, who is one of our major sponsors for our Pink Tea Fascinator. Where our organization, we made some beautiful bras to help raise money for the Women's Foundation Bust Bra Cancer event. If you came to the Pink Fascinator Tea, you probably saw some of the bras on display as you walked in, or on some of the tables. Well, they were so impressed with some of our bras that we did, that they gave me a call, well, I guess about 2 weeks ago, and they asked for two of our sisters to help design a bra for one of the models that that are going to do the runway for the Bus Bra Breast Cancer event, and that is Sister Nashawn, our third Madam VP, Sister Nashawn Stovall, and Sister Faith Wong Reed will be the actual designers for a model who will be on the runway.
And I have a picture. Our
Mm-hmm.
Madam President, Courtney Hunt, appeared on the news with Women's Hospital to promote this initiative with the
Yes.
bras.
You see that bra right there? That bra is Sister Nashawn Stovall's bra, and it has it has issue jags on there. And she came with the tutu, and I mean, look how pretty that bra is. So of course they would ask one of the ladies of the 100 to be a designer at their event. So we're excited about that, and that event is September 19th.
And so, also, besides focusing on breast cancer awareness, we didn't mention about how HIV has been something that's been brought to light recently for
Oh
our
yes. Oh yes. Oh yes. So I got a phone call, I think from you, Sister
yeah.
about a wonderful event. Well, we were invited to collaborate um, with in World AIDS Day Gala, Red Day, on on December 2nd in Baton Rouge. Well, as you know, that was a wonderful event. We had fun. We partied. It was beautiful. But as you know, December 1st is World AIDS Day. So on December 2nd, we partner with the AIDS Healthcare Foundation and Gilead and Baton Rouge Pride and Capital City Park and Louisiana Health and Hospitals for this event to make the help them bring awareness in the community about HIV and AIDS. There's over
Before this
7,000.
event, before
Uh-huh.
this event, we didn't realize how high the numbers were right here in
Oh,
Baton Rouge.
oh,
And I wasn't aware.
I got numbers for you right here, Sister Shanice. There's 22,000 people in Louisiana living with HIV. And 5,000 are right here in Baton Rouge, with 76% are Black men. And I checked this number out, 88% of those are Black women.
Yeah, and then when we attended the event, I was shocked. Like one woman said, I was married and my husband brought it home. So it's something that affects everybody, not just one demographic.
You know what? We have a stigma, and we got to break that stigma. We think of what does HIV look like? Who does that person look like? It looks like me and you, a normal person. Like the lady said, she was doing the right thing, being a mother, coming home, going to work, going to school, going to church. And she felt sick. She never would have thought that it would have been HIV. She was asking herself, what did she do wrong? She did not do anything wrong. Um, but I guess trust her husband. But as but which is normal. But even we should get HIV tested yearly. And so it's just very important for us to bring this attention. And also, they have a Louisiana law. They also brought up about that Louisiana law that they trying to change. You remember, Sister
Hmm.
Shanice, like Louisiana law states. Let me state it right. Let me look at it right. Louisiana law provides for a crime of intentional exposure to HIV and provides penalties such as a $5,000 fine or 10 years in prison. And what that means, that verbiage is so funny. So what
Hmm.
the AIDS Healthcare Foundation is fighting to change that law and change that verbiage and change it from intentional exposure to intentional transmission of HIV. So that law is very detrimental in the HIV community. So um, when you say intentional, that word intentional, that means like if you walk in a room with somebody with HIV, that's a crime.
Hmm.
That's a crime. That's a crime. So they're just trying to change the verbiage. Just so if you just intentionally expose to somebody with HIV, then it's a crime, not just if you just walk into the room, you know. So those are the things that are very important for 100 Black women to collaborate on with these organizations to bring awareness and provide resources and advocate for the law changes in our community. So
And
those are
so,
things we need to do.
and besides collaborating with outside organizations, you also
Hmm.
collaborate with other committees. And I hear you're
Hmm.
collaborating with the education committee for mentorship. So tell me, what does that look like, that collaboration with education?
Well, we did that already.
Oh, you did?
Yeah, we did that collaboration already. So it was a wonderful event. It was a wonderful event. The collab with the education committee was unapologetically be beyond, yeah, beyond 100, be 100. It's a mentorship program focused on developing future leaders and for girls 7th through 10th grade. We had Ms. Tanya Chapman, who is the eye care quality assurance manager with East Baton Rouge Parish School System. And she came in and spoke to the young ladies about self advocacy, developing health, and recognizing unhealthy boundaries. Um, she taught them how to develop assertiveness skills through communication, which is very important through adulthood, especially for young Black women. Um, she also gave them information on self care, mental care, by eating healthy, exercising, and learning to manage stress as a young Black woman. And they can bring those little tidbits to adulthood. So
Well, that's
that's a good
awesome.
thing.
So our mentorship program is teaching the young girls all types of things in different areas. So
Yes,
that's
yes.
amazing. Now the health committee always do these amazing raffles, and I hear another raffle is coming up. Um, Tell me what you're raffling off this time.
So we had a raffle in the fall where we raffled a beautiful Brahmin weekender bag. So this spring we have another. It was so popular and everybody was fighting over this bag. So we have another Brahmin weekender bag that's as you see on the screen. So you're gonna have another chance to win this bag, and these proceeds goes to the health committee for our programs that we've been talking about. So be on the lookout for that raffle in the future. So you'll have a chance to win that beautiful bag. It's nice. I
It
kind of want
is
to keep it for myself.
nice. I know I like that bag myself. And so,
Oh,
in addition
oh,
to the raffle coming up, we have a big event that's coming up real soon on the horizon. Our Be Healthy 100
oh
Health
yes,
Fair.
yes. So we have the Be Healthy 100 Health Fair, which is led by Sister Penelope Foster and co-led by Tramika Butler. And it's going to be on April 20th at Greater King David Church on Blood Road from 11 to. And we are blessed and thankful to Greater King David for sponsoring by letting us use their facility free of charge. And we are also being sponsored by Oshner and Lamar Advertising Company. So you might see our sign on a billboard somewhere in Baton Rouge. And so be on the lookout for that. And also, this is our second year for this event. And these ladies on this health fair committee has worked so hard, and they have something very special in store for the Baton Rouge community. But I don't want to go all into that because Penelope is going to be on next and give more details about this fantastic event. But um, I want to end by saying if you'd like to be a sponsor or give any monetary donations to or in kind donations to the health committee for our programs, just please email the healthcare committee at health@ncbwmetrovr.org.
And I put the email up on the
Yes,
screen.
please. In order for us to have these programs, we need sponsors, we need money. So please email us if you would like to donate, be a sponsor, or give in kind donations.
Well, thank you, Angela. You're doing an amazing job. Now we're going to switch
Thank
over
you.
to Penelope and get into details
Great.
about this health fair. So don't go away. We're going to come back to you at the end.
All right.
So up next is Penelope Foster. Penelope Foster is a registered nurse that has been in the healthcare industry for 23 years. She obtained her Bachelor's of Science in Nursing from Southern University and A&M College and is a graduate of Delta College Arts and Technology in Practical Nursing. She currently works as a travel nurse with a certification in chemotherapy and immunotherapy. Her experience includes oncology, med surg, telemetry, abdominal transplant, home health care, wound care, and mental health. She is a member of the Metropolitan Baton Rouge chapter and serves on the Health Committee, Member Care and Activities Committee, Public Policy, Standards, and Outreach Committees. Her dedication and commitment comes from her service in the United States Army Reserves, in which she earns medals of service in Operation Desert Shield Storm. She has a strong passion to give back to the community by volunteering and being a mentor to young ladies. And we welcome Penelope to the stage. Hi,
Thank
Penelope.
you. Hello.
We are so excited to talk about this health fair because it's buzzing. Got the whole town buzzing. So, why is it so important to bring health information and resources to the community?
It is very important to bring information to the community because our participants will have access to pamphlets and brochures in which they can take those home to educate themselves and their families. Also, it enables individuals to have their health checked at no cost, and to people who do not have health insurance and limited access to health care.
Now, Penelope, how long have you served on the health committee?
I've been on the health committee since I joined the coalition in 2019. So 5 years.
So, and this is your first year leading the health fair, right?
Yes,
So,
this
tell
is
us.
my first year leading a program in general.
Oh, okay. So, tell us about the Be Healthy 100 Community Health Fair.
The Be Healthy 100 Health Fair is a free event, and we're bringing together a variety of health professionals, including doctors, nurses, nutritionists, fitness experts, social workers, um, and other professionals. We're going to provide the attendees with a wealth of information and resources, including topics on health and disease prevention. Also, this is a free event open to men, women, and children.
So, Penelope, tell me, where did this bee theme come from?
The bee thing came from the day after I accepted the role of the lead. God gave me a vision to name the health fair Be Healthy combined with 100 because we are the 100. So that's where the name come from, Be Healthy 100.
Okay, it just came to you in a dream. And then we are at a church, so that's good. That was ordained by God. Look at that. Look at
Yes.
God. So, why is Greater King David Baptist Church the perfect partner for our health fair?
Greater King David Baptist Church is the perfect partner because mainly it's my church home and several of our coalition sisters' church home as well. The church is in the heart of North Baton Rouge, so we will have access to that community and surrounding areas. And also, it gives us access.
Access to everyone in the area, just a good location for community health. And we want to thank the Pastor Montgomery and First Lady Leah Montgomery for having us. We're so excited to partner with Greater King David Baptist Church. Tell us.
And
Go ahead.
I'm sorry, I wanted to add that the main and the next reason was the church is large enough to accommodate the amount of vendors that we have. So it's a very big space, and we have plenty vendors. So it's a really great spot.
Now, what preventative care screenings are going to be available the day of the event?
We have a lot of screenings that are going to be available. We have screenings for blood pressure, cholesterol, glucose, BMI, vision, HIV, and STI testing. We have fitness and posture assessments, COVID testing, and vaccines. And this is a free event, so no insurance is required.
All right, well, that's the best part. And so tell us about the speakers that are scheduled to be there.
We have four amazing speakers. We have Dr. Stephen Kelly with Baton Rouge Cardiology, and he will be speaking on heart disease symptoms and risk factors. We have Dr. Keita Patel with Excel Wellness Center. She will speak on women's health issues. We have Miss Bianca Coates, a registered dietitian with Eating God's Way, who will do healthy food demonstrations and explaining the importance of healthy eating. Also, we have Mr. Daniel Hammond with Better Body Fitness, and he will do interactive fitness demonstrations.
Now, why is it so important to take preventative measures regarding your health?
It is very important for all of us to take preventative measures because detecting early signs, individuals can take measures such as lifestyle changes, medical treatments to manage and reverse any disease process.
That's amazing. And so I know this health fair is for everybody, including kids. So what do you have
Yes.
planned for the kids?
I am so excited because we have a lot of fun activities planned for the kids. We have the East Baton Rouge Parish Library, mobile library that's going to be there. Kids will be able to check out books, and also they will be able to sign up for a library card. We have the Baton Rouge Fire Department that will be there to do education on fire safety and interaction with the kids. Also, we're going to share the book, What in the World is the Coronavirus, with the children. This book is a children's book written by our very own coalition sister, Martina Domino. Last but not least, to go along with the theme, Be Healthy 100, we are going to have a fun spelling bee.
Nice. So again, it's activities for the kids and for adults, for everybody. Everybody's welcome. So are you well, how many vendors do we currently have?
We currently have 56 vendors and our four speakers.
Okay, 56 vendors. That's a lot. So
Yes, ma'am.
this is the biggest health fair we've had so far, right?
Yes, ma'am.
That's double from last year, right?
Yes, last year we had 30 vendors.
Nice. So we keep growing every year. So are you currently looking for any more vendors? And if so, how do you apply?
We have space for only a few vendors because, of course, we have exceeded our goal of 45 vendors. And any vendors that are interested, they can apply on the event flyer. So we only have a few spots left.
Oh, wait, let me put the flyer up. I'm glad you said that. So this is the official flyer. If you want to register, we have a link that's on the flyer, but I'm putting it up big. It's a Bitly link, Be Healthy 100. Somebody watching, put this link up in the comments for us. Registration is free. Admission is free. We just want you to register. So we're super excited about this. Penelope, will there be door prizes?
Yes, there will be door prizes. We will have door prizes drawn by ticket every 30 minutes from 11 to 2, the entire time of the health fair.
All right. Well, we are so excited about this health fair. And again, we said it's open to everybody. It's friendly. Sister Jamisha says a wonderful family friendly event. And we have another comment saying you need to register today. So we are all super excited about this health fair. And let's bring up Angela so we can drive it home about everyone coming out. Hey, Angela. Oh, look, somebody
Hey.
in the comments saying door prizes. So they sold out with the door prizes.
Oh yes. Come on out. Come on out. Come on
Sister
out.
Susanna wants to win a door prize. So, Angela, why should everybody come out to this health fair?
Well, first of all, you should come out to this health fair because anything that 100 Black Women Metro Baton Rouge throw is awesome. First of all, everything that we do is great. Um, and you need to come out to this health fair because we have the resources for you. Sister Penelope have worked hard in her committee, and they've gotten all these vendors out here, all these resources for you. Um, we giving it to you. We giving it to you for free. We giving it to you for free. So just come on out, join us. We want you to, our initiatives is for you to live longer, decrease the death rate, mortality in our community, to make awareness to childhood and family obesity. All those things are going to be there. Metabolic syndrome, we're going to, diabetes, everything, hypertension, all those things are going to be covered there. So they have worked hard. They got the resources for you. So just come on out.
Oh, people are going out. Oh, here she go. Wait,
Uh-oh.
there you go.
Uh-oh. Oh, so come on out, bring your children, bring your husband, bring your grandmother, bring everyone. Because we're gonna have Dr. Kelly there speaking. I mean, hey, that's great. So we're gonna have some great speakers there at this event. So if I were you, I'd be there. I wouldn't miss this event.
Yes, absolutely. And the health committee is doing an amazing job.
Mm-hmm.
Penelope, you're doing amazing at the health
Thank
fair
you.
lead. This is going
Mm-hmm.
to be an
Thank
amazing
you.
event. I'm so excited about it. And, that's it. We are wrapped. Was it? I got to ask you, how nervous were you? This wasn't that bad, was it?
No, it wasn't. Be healthy, everyone.
Oh look, wait a minute, Sister Shanice. Go, y'all, please go to health at NCBW, metrobr.org. We're looking for sponsors, donations, and in-kind donations. So please reach out. And May 21st is the mental health series, and then be on the lookout for October for our breast cancer event, and also be on the lookout for our raffle.
All right, we got comments. Amazing job, everyone. Good job,
Oh,
sisters. Penelope Foster in healthcare. Everybody think
yes.
you're doing an amazing job. So thank you, ladies, for coming on the show this
Thank
evening.
you for having us.
Thank
And
you. Thank you.
I'll see you at the health fair.
All right.
Okay,
Thank you.
see
Good
you.
night, everyone.
Thank you. Good night.
Bye bye. And so thank you to my guests this evening, Angela Norwood and Penelope Foster, for being my guests and for all the phenomenal work they're doing on behalf of the Metropolitan Baton Rouge chapter. Stay up to date with everything we're doing by visiting our website. Go to our website at ncbwmetrobr.org to learn more about our organization and to join our email list. We have a newsletter that goes out weekly. So to stay in the loop, go to the website. On the homepage, you can scroll down to the bottom and enter your email address to get on our list. And if you want to support the work we're doing, you can always give a donation through our website. You can go to the donation link and you can link to our PayPal to give us a donation, or you can send a check in the mail. We'll take it any way you can get it to us. And again, if you have any questions about what the health committee is doing, you want to be involved in their upcoming events or be a vendor, again, the health committee's email is health@ncbwmetrobr.org. We hope you come out to our Be Healthy 100 Health Fair happening April 20th. I'm going to put the flyer up one last time. It's coming up at the Greater King David Baptist Church. Make sure you come out and see us and spread the word. Admission is free. So thank you so much for supporting. And I've been your host this evening, Shanice Lewis, on behalf of the Metro Baton Rouge chapter and President Courtney Hunt. Thank you for tuning in to Keeping It 100 Coalition Conversations. And until next time, God bless.